How frequently should you get maintenance Botox to prevent wrinkles?
That's a good one.
Okay, so kind of like when do we first start it? So when those lines start to stay. You don't want to come back when it's full on strong again.
Okay.
Like I always tell people, like when it's their first day, don't come back like this again. So you want to go, and I tell them, you're gonna know. You're gonna know. When it starts creeping back, you see little shadows here and there, you're gonna know something's up.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Well, hi.
Howdy. How you doing, Selah?
I'm good.
Yeah,
I
me
am
too.
very excited to talk to our guest today.
Why is that?
Because I love anything that will help me look a little less tired.
Oh, gosh. I mean, when you have 3 kids, you're gonna look tired.
inevitable.
Because you feel tired.
That's right.
Because boys have boundless energy. And we
Boundless.
can only keep up for so long.
Exactly.
Yeah, but
And no
our
sleep.
faces, on very little sleep. Our faces shouldn't have to show that and reflect how tired we are
Thank
most of the time,
God
right?
for modern things.
I know.
right?
Injectables. I feel like everybody has heard or has used Botox.
Yes.
But they're like, wait, there are other options out there?
I know. I want to find
Yeah,
out. I have
yeah.
heard about other options. I myself have tried other ones, but there's always new ones on the market.
The technology keeps evolving. And I feel like when Botox first became one of those words that you were hearing all the time, you associated Botox with a frozen face.
Exactly.
And now that's not the look.
I know.
That is not the look.
Exactly.
You just
Yeah.
want to look refreshed.
And
Relaxed,
yes.
right? Which is exciting because we get to talk to our guest today, who is a physician's assistant with 7 years of experience. Her name is Jeanette.
Yes.
And she works at Face and Body Aesthetics and Plastic Surgery in Upland, California with Dr. Edward Parr.
Yes.
Yeah.
And she specializes in injectables and neurotoxins such as Botox, Dysport, fillers, and laser treatments. So I want to hear about that.
Let's bring in Jeanette.
Jeanette.
Here we go. Jeanette is joining us today. Welcome, Jeanette.
Hello. Hi, ladies. Thank
Hello.
you.
Thank you so much for being here. You
Yes.
work with Dr. Parr.
Who we
Yes.
love.
We love
We
him.
love Dr. Park.
At
We
Face
love
and
Dr.
Body in
Park.
Upland
Very
in
lucky to
Inland
work with him.
Empire, right?
Yep.
Yes. Okay.
I have been with him for 3 years.
Oh, 3
I have been
years.
doing in this industry for about 7 years.
in the
Okay.
industry for 7. Okay,
yes,
great.
Yes.
And do you specialize in all injectables, Botox, Dysport, Xeomin now, fillers?
Yes,
Okay.
Botox, Dysport, the more common ones. Recently, Jeuveau.
Okay.
So, yes, and then all the injectables.
All
yes.
the injectables.
Yes. All of
Amazing.
the reversible injectables.
What's your favorite thing to do?
It changes. So yes, I do love the cheek filler because they call it the injectable facelift.
Ooh.
So, Dr.
You're like,
Park
tell
doesn't
me
wanna
more.
hear that.
Yeah,
but
true.
I do love the lip filler. Just instant, changes face, really simple, super easy to do.
That's awesome.
Yes.
Okay, so going back to how beautiful you look, what injectables do you use? What do you like?
So I'm lucky enough to where all of them kind of work on me. Some people are, one will work better than others. So Botox or Dysport, Jeuveau, the Restylane, the Juvederm. Some of them work better for others. But for me, I'm pretty, whatever they have out,
Versatile.
whatever is open, I'll take
You'll
it.
do. I have found personally, if I use Botox for a while, it stops being as strong or as effective. So I switched to Dysport. Is that true? Or is it in my head? It is true. Okay.
I do have people that will alternate. So every few months, they'll okay, let's switch it up. It's kind of like changing your shampoo, changing your skincare.
Oh.
I've heard shampoo is a
Yes.
thing too, by the way.
Yes, it
Okay,
is
so-
a thing.
If you're someone like
Yes.
me, I have never had injectables
Can you
before.
believe
so
it?
I mean,
she looks amazing.
Thank you.
She really looks amazing.
But I don't I don't know the difference. I mean, I feel like Botox is such a colloquialism now where we talk about it
Yes.
like, oh, Botox, Botox, Botox. But you're dropping terms like Dysport. I've never heard of that. I don't even know what that is. Can you kind of break
Yes.
down what are some of the injectables that are offered at your practice?
So we have, of the neurotoxins, we have Botox, Dysport, and Jeuveau. And as you can imagine, most people come in and they ask for Botox. They don't really know what it is. They assume it's like Kleenex, like, oh, I want whatever Botox does. So I will explain to them, I give them the education, and then just through chatting, I kind of see what they want. If they want more natural look, most people will say they just want a natural look, just a softening of the lines. Other people are like, nope, I don't want to move. Get rid of it all.
Freeze
Freeze
my
this face.
Yeah.
Freeze my face. And over time, those people who were like, I just want it conservative, they're like, nope, forget conservative. So we just have to kind of go over everything and then just kind of gauging how comfortable they are. If they're very nervous, then I'll just keep giving them more information until they just get more comfortable with me.
Right.
So if I'm a brand new patient
Yes.
and I'm just starting out, I don't know what I don't know. How do you ease me into it? What are some of the questions you might ask me?
I will ask you, what area concerns you the most? What
Okay.
really bothers you? So most people will say, it's the 11s, the line right in between their brows. Some people will say, oh, they'll point to their whole face. They're like, all of this.
All of
everything."
this.
They're like, I want all of this done.
Yeah.
So
The bunnies.
yeah. I'll say, okay, let's kind of like narrow it down. What did you come in for? And most people will say like, oh my God, my dad has this line right here and I don't want that. So then I can say, perfect. So we usually treat one area. Have them come back and then once they're comfortable, then we'll do more.
How painful is getting an injectable, especially if you're a newbie?
Yes, I tell everybody it's a pinch and a sting. Yeah.
Okay.
So you feel the pinch with the needle and then you feel the Botox coming in. So it is a sting. It does.
What does an ideal candidate for any of these procedures look like?
So just somebody who makes an expression and their lines just kind of stay. Somebody who has volume loss, a lot of people with weight loss. If we don't have a whole lot of fat anymore to hold them up, not much support, so they're ideal. So we always tell them if you feel like you're at that age, look at your expressions. Are the lines staying a little bit longer than they used to? Are they disappearing? So we're getting adults younger and younger
Yeah.
that think that, they need preventative Botox.
Well, I feel that. I was 26 when I started.
What?
Yeah, I know. I had very, very pronounced lines because I was a theater actress, very expressive.
Yes.
And I will never forget, I had a client who said, you really need to get Botox, it's preventative. But she was in a loving way saying it. So I did, and I never looked back because it
That
really
was
helped.
great.
It was
See?
so actually great. of
Yeah,
her
see,
to
so
tell
many
me.
people don't talk about it. And I think that's why so many people come in with these questions of like, they wait usually until it's too late. And then I'm like, oh, I think you're more of like a Dr. Park patient.
But I mean, isn't there a fine line though? Let's be honest, because if you're of a certain age, sure, like it's almost not expected, but it's like, oh well, if she gets a little bit of Botox, she's in her early 40s. That kind of makes sense. But in
Yes.
this social media generation, sometimes it seems a bit excessive that they're jumping into getting some of these procedures a little bit too early. Is that something that you've seen, like at least
Yes.
trending?
Yes. So we do have younger and younger, and I think the market is targeting them younger and
Wow.
younger, where
Yeah.
they're saying where it's like preventative.
Yeah. What do you think
so
of that?
they do come in, and then we have to educate them. We're like, there's nothing there. Or if they come in too soon, like it's
Yeah.
not moving. Like
Right.
like a few months ago or last year, you told me you wanted conservative, but now you're bothered by like a little kind of dimple on your forehead that I can't really see. So if I can't see it moving, I'm not going to treat it. I can't inject it.
Okay.
I appreciate that,
I do
Jeanette. I
too.
appreciate your
Yes.
honesty because it's not like I'm gonna like make some money off of this patient. It's like, well, you don't really need that. I'm not gonna give you something that you don't need yet.
Now, what about, I've heard of Botox for sweating
Yes.
and Botox for grinding. Like you mentioned a little bit, right? For doing it here.
Yes.
What's that all about?
Yeah. So a lot of people grind their teeth at night, or we just have like a stronger jawline. So the more you're using that muscle, the bigger it's getting. So if we relax it, inject a little Botox here, it relaxes your muscle where you're just kind of like, people with TMJ disorder, they can totally feel that. Like a lot of people come in because they have pain, they're always clenching their jaw. We don't treat it for that. That's not in our scope of practice because we're aesthetics. That's going to be more of like dental procedure.
Oh, okay.
So we say it's more of like a facial slimming. Yes.
And for sweating too, where you
For
inject
sweating,
it?
yeah. So we inject it in the underarms, palms as well.
Wow.
So it's quite it's more units.
And for migraines, I've heard.
And for migraines, yes.
Where do you inject it?
So that's also for neurology. So
Oh,
they
okay.
I think they usually attach to see where your muscles are firing, and they inject it all over the scalp, sometimes in the neck. So they do hundreds of units.
Oh my god.
So I have some ladies that are like, oh, my neurologist is cool. He did a little Botox on my forehead. So now can you do me right here and here?
Oh, that's funny.
What would you say is the average age of a regular patient you see?
For our demographic, every med spa is a little bit different with their demographics. So I would say the average age is like early 30s.
Really?
Mm-hmm.
Wow.
Yeah, everybody's just more savvy now. They're more educated. They hear about it. It's not as taboo. Like
It's
people
not a
will even
stigma.
like record while they're there, while they're getting injected.
You know what I've always been concerned with when you're getting fillers or Botox or any kinds of facial treatment? Like, what does the recovery period look like? You're saying that it takes a little while for you to really see the full result of it, but how long is it
Yes.
going to take you to recover from having these injections?
So it's still a needle in your face. So I always tell them, I can't guarantee that you're not going to bruise and that there won't be any swelling. So don't come see me if you're getting married in a couple of weeks, or don't if you have a photo shoot this weekend. Like, no,
Yeah.
it's too late. You should have come a month ago. So
Right.
yeah, there's always going to be some swelling just from the trauma of the needle. There could be bruising, but usually the downtime, depending on age, of course, most people bounce back. The older you are, the people who bruise really easily, they can bruise for like a week.
Aren't you supposed to not lie down for 4 hours and then?
Oh,
you
I
don't-
never knew that.
Yeah, and don't sweat for 24 hours. That's what I heard.
Is that true?
Yes, like the blood circulating can cause the
Oh.
neurotoxin to spread around to other areas that we didn't intend for it to go. So that's when people have like a lid come down, and yeah, I just
Okay.
tell them just kind of be upright for the next few hours. Don't touch it. Leave it alone. Don't do anything strenuous.
No makeup.
exercise, makeup, just because of infection purposes. But yeah.
Okay.
I mean, I've told people this, and I see them go in the bathroom and put on a full face
Oh,
right afterwards.
Which factors should someone consider when they're choosing the best provider for these services?
So you want to be with somebody you're comfortable with. You want to make sure that their credentials are correct. So you have to be a registered nurse or higher. A lot of people don't really know that. They're just like, oh, I don't know what you do. I just trust you just because you're here.
Wow.
Yes.
Okay.
Yeah. And so then I tell them I'm a physician assistant. And they're like, oh, cool. Even better.
Yeah.
I'm like, oh.
You're like, that's important.
It's important.
That's important.
You want to find out how many trainings they do. You want to find out how often they actually inject. So there's a lot of, part-time where, maybe your injector, yes, they are there, but what if they're only there once a month, once a week? What if they're normally in the hospital,
Right.
right? You want to find out what they do on the day-to-day, what their style is. Yeah.
Oh, that's good.
How long they've been doing it, of course, what their priorities are. So we always stress like safety is more important. We like a more conservative look, a natural look, something that's just going to bring out your more natural features, not necessarily change you into an entirely different person.
Right.
Yes.
Speaking of, I've heard of people doing nose fillers and chin
Yes.
fillers. What are those?
Yes.
What's that about?
So chin filler is, I've had a few syringes of chin filler.
Okay.
So that's actually one of my favorite ones that I have had done to myself. It was
why?
a huge game changer.
Wow.
It just
So,
like helped
tell
with
us.
my profile. So a lot of
Oh.
people are like, I want like a quick fix for like my double chin, or like my jawline is starting to just look like real modeled and just like not really just sharp. So a little filler here, it just makes such a huge difference.
And it's on the sides or like underneath?
It can be here, it can be on the sides.
okay.
Usually it's on the chin, and then
In the
it's also
center.
right here.
On the sides.
jawline.
If you're listening, it's like underneath
Yes.
the
It's right
ears
underneath, right
and the
here,
jawline.
where your
Okay.
jaw is. Yeah. Where it
Interesting.
clenches. So yeah, most of the procedures to kind of minimize the double chin, they do take a while because we're melting fat. Dr. Park's removing fat.
Oh, wow.
So filler is a nice, just quick, makes a big, huge difference.
Non-surgical, quick fix.
Non-surgical, safe. You want it right away. Helps with lips, especially as lips are getting bigger. We need the chin to kind of balance it out.
Mm-hmm.
What's
Yes.
the price range for some of these procedures?
Oh, yeah.
It can range with the area. Yeah. So Botox, I usually tell people, Botox, Dysport, Jeuveau, I usually tell people, you know, save up like $500 to $700 every few months, every 3 months. That's what you're putting away to get your Botox regularly. And fillers, they can range from, you're doing a syringe, so it can range from $500 to $1,000 per syringe. And a good general rule of thumb for people who are thinking about doing fillers, and you know, because a lot of people think they can just do one and it's going to fix everything.
Yeah.
No, so we usually say if you're in your 40s, then you probably need about 4 syringes of filler
Wow.
for your whole face.
And how long does that
Yes.
last? Do you think?
It lasts a couple of years.
Oh, that's right. Okay,
Yes,
so that's
yes.
good.
Yeah, and it doesn't mean you're doing 4 syringes for the rest of your life every year. If we do the baseline and do everything that we need to do, some people do like 10 syringes in one sitting. And it doesn't mean they're doing 10 syringes every time. They're coming in regularly every 6 months, every year. We're doing a syringe here and there, and
Okay.
sometimes not at all.
Like just for regular maintenance.
Just for regular maintenance.
Yeah, that makes
Okay.
sense. That part makes
Yeah.
sense.
Yes.
Is it? Can you finance it with CareCredit?
Yes.
Really?
Yes,
Oh
it's
my
actually our
gosh.
favorite thing because a lot of people come in and they're shocked. They're shocked at the price. They're shocked at what they actually have to do because, you know, they're like, okay, my budget's like $200.
Oh.
We're like, okay, well, you can get a facial.
That's about
Yes. So it's just nice when we could say, you know, you could finance it, you know.
Do you like when people bring you like before and after pictures or pictures that they've seen on social media and they're like, okay, I'm kind of, oh, you're already making a face, Jeanette. But, you know, like, because that's where a lot of people get their inspiration from their house to their car to their outfit and to their face.
Yes, yes. So it is helpful to know that they have an idea and they're more savvy. But then I tell them, like, your lips are completely different. Your lip shape. What lip filler will do is volumize. We can't change you from having, you know, a wide mouth to like a little pout.
Sure.
Right.
Basically. So some people want a keyhole. They're more of like an M shape. So it's just more education of, I get people who bring in a fully filtered picture, Snapchat picture of themselves.
Ugh.
Or a picture of them laying down and they want all of their skin pulled back. So I'm like, okay.
Dr. Park?
Dr. Park, can you come in here?
Dr. Park.
That is
So while it's
Yeah,
helpful,
it's
you help them
helpful,
set
but we
realistic
usually-
expectations.
Yes.
Okay.
Yes.
Okay.
Yeah.
How do you maintain a natural look and don't over-treat?
Ooh, that's big.
Yeah, especially in this day and age, right?
Especially if somebody's bringing in a fully filtered
Exactly.
picture.
Yeah, yeah.
Yes. So I usually tell them if I don't see an issue, then are probably better off with somebody else.
Okay.
Yes, because if I don't see an area to inject, then I have to tell them like, I'm sorry, I don't see anything wrong there, but we could do this instead. But if they're insistent on it and they're seeing something that I'm just not, then I have to be honest and tell them like, I might not be the injector for you. Yes.
I've started to notice just recently that I love to smile. I love to laugh.
course.
And I'm very expressive with my face. And I feel like everybody has smile lines, like even my son who's 5.5 years old.
Exactly.
I don't want to get rid of my ability to have a big smile.
Yes.
But I also don't want like lasting like little indentions for those smile lines. Is there like a happy medium that we could do
Yes.
to make sure that I still can do all the things I want without limiting?
Yes. So a lot of
myself.
times people see a line and they're like, just fill it. Like they really want me to
Fill this
just like,
line.
they're like, here, just take this and just fill this. And I have to tell them, like, if you look at your child, if you look at babies, they have these lines here. And a lot of people don't want them all. They want them gone. So I tell them the reason why you feel like this is a big, deep line is because your cheeks are falling. Your cheeks are falling because you have no volume here. We're losing bone. We're losing volume. less collagen, less elastin. So I tell them we have to fix the problem, the actual cause of the problem, instead of just treating symptoms. Okay, so I tell them like this is going to start to overfill. It's going to look very unnatural. And then I just kind of show them. I just, kind of pull them back very subtly. And then they're like, oh, yes, I want that.
Do that for me.
Just do that instead. I'm like, okay, well, that's going to be like 5 syringes compared to like the one that you just wanted in there.
I see. Okay.
Yes.
And that's more the cheek filler, you're
Yes,
saying.
and that's going to be a more natural look. So people hear like 5, 10 syringes. They're like, oh no, then I'm going to look like this. I'm going to look unnatural. But I'm like, the less you do, people tend to look more unnatural.
Oh, really?
Really?
Yes.
Why is that?
Because you're kind of spreading that thing around where it's like if you only have 1 syringe, you're putting it in wrong places.
Right.
Yes.
That you don't need it.
Where you don't need it.
Okay.
Yeah.
Okay, that makes sense.
Yeah, just like if we were to half treat you with Botox, just do one area, then that's when you notice people like, why is she so smooth right here? And
Just
then
right there.
everywhere else is like
Ton of wrinkles.
moving,
Yeah.
super strong.
Yeah.
So
I
cheeks
know.
become super strong, the nose, everything, eyes become super strong because of that one area is not moving.
How have you seen how having some of these non-surgical procedures impact someone's confidence and self-esteem?
Oh, it's huge.
How?
Such a big difference. I have people coming in because they have an interview or they have to do a Zoom call and they don't want to make faces. Or, I have people ready to get back out into the dating world. And I actually have a lot of men that are like, I don't want to look angry. I want to look more approachable.
Mm-hmm.
And they come in really apprehensive at first. And then after their like second, third visit, they're a whole other person.
Really?
Yeah.
They're like, yep, do it. I need it. And
It's those anger lines. Like I find sometimes I wear the stickies at night because I'm sleeping in a frown. I'm like, I'm not an angry person. Why am I sleeping?
yes.
Intense
And they're
dreams.
saying that you're not supposed to use them anymore.
Wait, why?
Because you're ripping off your
I
skin.
I do the
continuously.
smoothies, the silicone smoothies. Is that still
Okay.
ripping off your skin? Oh no.
No, it's like slightly, but it causes like
Okay.
dermatitis in a lot of people.
Oh yeah, I
yeah,
can
it's
see
just
that.
that infection.
You know Jeanette's going to be
But
honest.
yeah,
That's
I
why we
know.
asked her here.
I'm glad.
And
I
speaking
wanna
of
hear it.
asking her here, we have to ask you.
Oh.
I know you're the expert, so this is our section
Ask
of the pod
the
called
expert.
"Ask the Expert."
We
So
love
these
it.
are questions that come anonymously
Mhm.
from our audience members. Okay.
Okay.
So, and we just want you to answer them honestly. Okay. Here's the first one.
Okay.
How do I get rid of wrinkles that I got from weight loss?
Ah.
Ooh.
So that sounds like it's skin just kind of coming down. So that's going to be more filler.
Filler.
Okay.
Yes.
Well, and
Yes.
this one we also asked Dr. Park, so it'll be very
Oh,
interesting
yeah.
to hear your answer.
It's a newlywed game.
It is a newlywed game. Do you recommend let's see if I get it right, blepharoplasty versus Botox
Yes.
for sagging eyelids on a 46-year-old woman?
Nailed it.
Oh, thank you.
You're welcome. High five.
So I'm a 46-year-old woman, actually.
Mhm.
Yes.
So Dr. Park will tell people that you need both. So even though he
Oh.
does it, it's not going to stop the muscle from moving, from contracting. So
Okay.
you're still going to get that lid laxity even
Okay.
after a bleph. But most people, I will recommend them to do that first because it's a one and done. It's a much better result. And then, depending on how far gone they are, maybe at 46, they feel like they're not quite ready for that yet. 46 might be too far gone to do Botox.
Oh,
They might
okay.
already have that. So they would need to combine.
Okay.
So I usually recommend they do the bleph as well as Botox
And then
regularly.
maintain with Botox.
Yes,
Okay,
they have
I
to
see.
maintain that bleph.
Interesting.
Okay, this person wants to know, does Botox make wrinkles come back better or worse if usage is stopped?
So a lot of people think that. So what happens is after the 3 months, 3 to 4 months, they're 4 months older. So they are always like, oh, it made it worse.
Oh, you didn't stop time?
Yeah.
Okay. Oh.
Yes.
So what I
So,
found, because I
after
took
3 months,
6
yeah.
years off to have
Yes.
kids, I found it actually made it better because I got used to not using that muscle.
Exactly.
Right? Okay, so that wasn't just
Yes.
crazy of me.
No, that's
Okay.
not crazy. Botox, it will retrain your muscles.
Yes.
So we're used to being so animated, so
Mhm.
making all these faces, and of course we're happy we don't do this. But it's like I found that with Botox, it's just kind of like calmed me down.
Yeah, totally.
It's like, is that expression worth it? I used to demonstrate, okay, raise your eyebrows,
Right.
squeeze them together, smile real big. Now I just say it
Yeah, you don't need a demo.
Yes.
But
no,
it's
but
true,
it
I
will not make
know.
it worse. They have found that even if you do it once, you're going to be better off than someone who
Totally.
doesn't do it ever.
Agree completely. That's what
Yeah.
I found from my
Yeah.
experience.
Yeah,
It was
it's
much
taking
better.
a break. Your face is taking a break.
How frequently should you get maintenance Botox to prevent wrinkles?
That's a good one.
Okay, so kind of like when do we first start it? So when those lines start to stay. You don't want to come back when it's full on strong again.
Okay.
Like I always tell people, like when it's their first day, don't come back like this again. So you want to go, and I tell them, you're going to know. You're going to know. When it starts creeping back, you see little shadows here and there, you're going to know something's up.
Okay.
And you're going to look at your calendar and be like, oh, it's been 3 months.
I was due.
I need to
Yeah.
go. Yeah.
Yep, that makes total
Yeah,
sense.
so the best is like to come in, let's check it out, and I will tell you like, okay, I think you're still a little too soon. Let's
okay.
push it back.
So you'll be honest.
Yes.
Point at you.
If you inject the wrong muscle, they will come back and be like, what'd you do to my face?
Oh, totally.
Yes.
Of course. Yeah.
I feel like this is something though that people really want to know as well, and it's about the dark under eye circles.
I want to know that too. Add that to my list.
Well, I mean, a lot of people
Very
have
hard
dark
to
under eyes.
treat. Yeah.
Really? How
Very
do you
hard.
Treat, how do you treat dark under eye
Not
circles?
with filler. Filler will not make your
Okay.
under eye change color. It will not brighten. It's hyperpigmentation. I always tell people, well, are you sleeping enough?
No,
Are you
I'm
drinking enough
not.
water? So everyone says no, no, no.
Mhm.
So I tell them, okay, even if we do this, if you're still going to continue on that path, then you're going to end up with the same. So I tell them with their skincare, improve your hydration. We can put Botox there. We can put a little bit filler on their orbital rim that will reflect light, help it deflect it a little bit so it's not coming down as low.
Mm-hmm.
So if we put filler right on that rim, it kind of perks it back up.
Okay.
Yes,
But
but
get more sleep.
I never promise them that it will get rid of that darkness. Sometimes it's hereditary.
Yeah, I was born with circles under my eyes.
Yeah.
Literally.
Yeah. So PRP is great for that. It helps to
Oh,
brighten it up as
really?
well. So your plasma.
PRP. Do you want to explain
Yes.
that? What
Yeah,
that
what is PRP?
for
So
our
platelet
rich
rich
plasma.
plasma.
Right, okay.
Yes. So we're drying up your blood. We're putting in a centrifuge. So the top part of it is like that liquid gold. And we can either place it on the face, combine it with microneedling, which is the pen. We go over the face, we kind of go over that, opens up the channels, and then we inject or either place the PRP right on that.
Wow.
So
that's
it's stem
amazing.
cells for your face.
Yes, I actually did it for my torn meniscus.
Yes,
And it
see?
healed it.
Isn't it amazing?
It's amazing.
Yes.
It's like a miracle. It's your own body.
It's your own body.
Yeah. Okay, this person says, I've been told I have a baby face. What would you recommend I start with?
A baby face. What do
I
they
know.
mean? Like
Maybe
round?
round. They want it
So
more
that if
sculpted,
they want
maybe?
it more like sculpted, then it would be with filler.
Okay.
So if they're just like kind of have a round face, they say that the look of youth is a more V shape.
Oh.
Yes. So that's where the chin filler comes in and the cheek filler. So if we place them up here, down here, it's like sharp. Yeah. So if they have a round face, then we try to convert them over to like
A V shape.
A V shape.
Interesting. Wow, Jeanette, I thought I knew all there was to know because I've been doing it so long, but I have learned so much and I'm signing up for so much.
Mhm, you've added to her
Oh,
list already of things that she wants to have
I'm
done.
coming in.
Take care of you.
And you have piqued my interest too. I'm not ready yet. I'm not ready yet, but at least now I feel more informed.
Yes.
Exactly.
And that's exactly what the purpose
Yeah.
of this is, so that we feel more informed and that we take the taboo away from these elective procedures. Because if it
Yes.
makes you feel good and the bonus is that you look better, why not do it?
Exactly.
Yeah.
Thank you so much for coming in. We appreciate you.
You were awesome.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.